Here with me now are Spurrier and Pascal Wolter. Welcome.
Thank you. Thank you.
So when we talk about fake news or pseudoscience, what are we talking about? Gilly first.
We're talking about anything that doesn't have evidence behind it.
But there's often a little bit of evidence, isn't there?
In all science, we never know the full truth. It's always most of the truth or part of the truth, and we have to work with the evidence we have. And we don't want patients going to sites or going to places where there's no evidence.
So what would it be? What would an example be?
There are a lot of different possibilities, and the problem indeed is that for the majority of these comparative medicines, there's no proof.
And as a doctor, how often do you get someone coming to you with, I read in the paper that, I should have turmeric, or I shouldn't eat bacon or sausages anymore?
Well, to be honest, I'm very happy if the patient comes to me asking this question, because we know from the literature that the majority of patients, cancer patients, are interested in complementary and alternative medicine, but they do not discuss this openly with their oncologist. And this is a problem, because some of these complementary medicines can interact with my treatments, either chemotherapy or targeted agents. So for me, it's very important to know what my patients are taking.
So they can interact, because we think of them as being at best, at worst, harmless, don't we?
That's not the case. For example, St. John's wort or curcumin and so on can interact with a lot of drugs, and I have to know this before I start, for example, chemotherapy or targeted agents.
Even if there is a placebo effect of these drugs and it's relatively innocuous, the problem is that that may mean that the patients do not use their normal treatment. So a placebo can also stop you taking the right treatment.
Yeah.
How often do you find that people say to you, I'm not going to go the conventional medicine route?
Yeah, I mean, on patient forums, people are pretty honest, especially if they feel safe on a patient forum. So if it's secure and safe, they can say things that sometimes, if you're lucky enough to have a decent oncologist, you can say everything to your oncologist, but many do not. So they will say things on patient forums that is much more open. And we know already that patients don't tell their doctors sometimes what they're taking, but on a patient's forum they do. And so it's very important for us as a patient organisation to guide them into what they should be looking at before they go and do this therapy, what information they're looking for.
And I suppose, would one solution be that maybe doctors there's more of a trust, more approachable? People feel they can say, I've been considering doing X alternative therapy.
Well, I think first of all, you should be open-minded to your patients. You can make your patient a partner in the treatment process. A patient can do a lot. There are a lot of studies showing that physical activity is a good thing to do for cancer patients, that a healthy diet can be very beneficial for patients. This can be beneficial not only for the patient, but also for the oncology and the relationship.
And knowledge protects. Knowledge is power, what everyone says, but knowledge also protects. And we really encourage our patients to be proactive. And proactivity means, looking at the conventional medicine that you're being offered, making inquiries around other things if you want, but only going using stuff that's actually going to be useful, as evidence-based, and that and share that with your doctor, share that with your team, but be proactive, absolutely. But there are some oncologists who will say that to their patient, I only practice Western evidence-based medicine, which is kind of true, but it's going to lose you the patient. And where's that patient going to go next? They're going to go online, they're going to find everything else, and they're going to totally mistrust the medical profession, which is unhelpful for all of us.
Yeah.
A really interesting topic. Thank you so much, both of you, for your insights. Thank you.
A pleasure.
Bye.
Thank you.
Thank you very much.